is Amy Frazier. I am at Jackson Memorial, and I'm here for an ablation surgery for an acardiac twin.
I'm George Frazier, and I'm here with my wife for the surgery.
I know the procedure that I'm having is called an ablation for an acardiac twin. Originally, the twin was supposed to vanish, but unfortunately, it grew its own little umbilical cord and kind of like continued into a mass. We have one healthy baby, and I know that they're gonna go in and just kind of cauterize the connection just so that the healthy baby discontinues pumping double and doesn't go into cardiac arrest. We're hoping for the best outcome, and I think that we have a good team behind us here with the surgeons and the nurses, and you know, we're taking it as it comes.
Do you know if they already called for her, or do I have to call? We have to. So the C-section that was coming from the 7th floor, it's already in the OR. And then we'll roll Dr. Homer's section. My name is Denise Macbeth. I am an associate nurse manager for the labor and delivery unit. Since I have been working with physicians for a while, it feels amazing to see these attendings that were once medical students and to see them how they have grown as amazing providers. We do have a BTL in room 23. However, I was telling Dr. Kurian that today it's kind of hard, so I wanted to schedule her for tomorrow. Okay. What's different about the doctors at Jackson is that they are exposed to a lot. We have a trauma unit. Even though we're obstetric providers, we are involved in all the other cares. Transplant patients, patients with heart conditions or bleeding disorders. We are a very big multidisciplinary team, and that is what makes them great.
My name is Rodrigo Ruano. I'm the chief of the maternal-fetal medicine division and the director of the fetal center. I'm a fetal surgeon, and then I deal with some complex cases, sometimes very high-risk pregnancies.
Dr. Ruano does amazing things. He performs surgery in the babies before they're born. Patients come from all over the world to receive care from Dr. Ruano and his maternal-fetal medicine team. Just recently, he performed a procedure on a baby that had an aneurysm. And that was the 3rd successful procedure in the world.
Yeah, no, I'm okay. I just get emotional when I talk about my babies. That's all. My number one employee is my son, Nathan. He's 5 and he never slows down, but he takes care of me just as much as I take care of him. He was hoping for a baby brother from the start, and then he started calling it baby sister for a little while, but we just found out maybe like 4 days ago that we were having a boy, so we let him do the whole bite into the cupcake, see the blue, and he was very excited.
This pregnancy is complicated by a monochorionic, that means one placenta with 2 amniotic cavities, and then one of the twins did not develop well, so we had a cardiac mass that was stealing blood from the other twin, and the other twin was getting sick, so we decided to stop that mass, and then the other fetus can do well. This type of complicated pregnancy is very rare. We see here frequently because we are a reference center, right? We can perform those procedures since 16 weeks until 26 weeks, more or less. The objective here is to perform the procedure as soon as we diagnose to prevent complications. One of the complications is in this situation when you have one normal twin attached to a cardiac mass that is stealing blood from this normal fetus, is that the heart can fail and we can lose the baby. There are many different types of fetal surgeries. We can do under ultrasound guidance with a needle, and that's very less invasive. And that's what I did here. So I used the ultrasound to guide me towards the vessel that was feeding that mass that was stealing the blood from the normal fetus. and then I just touch with the needle that vessel, and then using laser we occlude that vessel. In order to have this high complex center situation, we need to have a multidisciplinary approach with different specialties taking care of the same patient. So it's very important that we have high-risk OB team, maternal fetal medicine doctors, generalists, obstetrics, pediatrics, cardiologists, anesthesiologists, nurses, everybody together to provide the best care to the patients. I got to the maternal fetal medicine, I think, because of what? First, because I fell in love with obstetrics and I fell in love with the high-risk pregnancies, the opportunity for us to change the natural history, that means the outcomes for those patients, and especially for those babies. Because when I started, we were performing lots of different beautiful prenatal diagnoses, and then we were not treating those babies. Now we progressed a lot that we had the opportunity to treat them before they are born. So I'm passionate and I love what I do.
He's actually going to be George Fraser the Sixth, so he'll be G6 for short, and hopefully he will carry on the Fraser name as proudly as his dad and his grandparents do, and we can't wait. G6, since the day one, we've been doing things to our best ability to keep you healthy and safe, and we can't wait to meet you and just love on you physically.
Mom and Daddy always got your back no matter what. This Mom and Daddy got every step of the way. We'll always be here for you, just to make sure we got your back to help you push through things that you don't think you can get through yourself.
The procedure
Okay. Everything went well, okay? Everything went well. Are you feeling pain?
I'm close.